It's time for Medical Moments with Covenant Healthcare. We're kicking off National Heart Month, so we're talking about stroke awareness, things like signs, symptoms, and what can be done to prevent one. With me here today is Melissa Duchesne. She's a registered nurse and stroke program administrator with Covenant Healthcare. Thanks so much for being with us this morning.
Here.
We appreciate it. So to get us started, let's talk about what a stroke is.
So a stroke, there's actually two different kinds of strokes. One's an ischemic stroke, and that's a block of blood flow to the brain, so it deprives your brain of blood and oxygen. Then there's hemorrhagic stroke. Ischemic strokes make up about 87% of all strokes, and hemorrhagics about 13%.
So why are they so common?
Well, I think mostly because of the risk factors that lead to these strokes, and maybe a lot of people aren't aware of them, and so that maybe they're not getting medical treatment to help prevent them, and so then we end up with patients that come in that have strokes.
So you mentioned maybe not aware of them. So what are some of the signs and symptoms?
So so American Heart uses the acronym FAST. So that's usually the basic face, arms. So your face is unequal. Your arms may drift down. Maybe you have some weakness in your leg, and maybe the speech is off a little bit. But then there's some really uncommon symptoms, and sometimes it's in the back part of the brain. So maybe you have a little bit of balance difficulty. Thinking difficulty, maybe you can't get words out like you normally could. So sometimes they're a little bit more difficult to pick up.
So if you do have one of these, you notice one of these in yourself, what should you do at that point?
You should definitely call 911 and come to the emergency room and get checked out. Do not go back to bed. A lot of people do that thinking it's going to go away. Maybe they thought they slept on their arm wrong, but get checked out and be safe.
Yeah, very important advice to get to the hospital as soon as you can.
Yes.
So why, again, is that so important to act very fast?
So getting to the hospital quickly, we can give you medical treatment that can save your life. So there's medication that they can give, but you can only have it within the first 4.5 hours. And now there's new interventions they can do where they can possibly pull out the clot. That sometimes they can go out a little bit longer, but getting there can help save the brain tissue and hopefully make your recovery a lot better.
All right, this sounds pretty serious. We know strokes are.
Yes.
Are they preventable at all?
Yeah, so about 80% of strokes are preventable. Blood pressure being the #1 preventable risk factor for stroke. And you can prevent it by taking your medications, keeping track of your blood pressure, taking the medications, keeping your blood pressures under control. Atrial fibrillation is another one. So if you have it, just taking your blood thinners, making sure you're keeping up on all those things.
Some good advice there. So yes. Covenant is a primary stroke center. What does that mean?
So there's different certification levels. So we just have different processes in place. It's a state level certification, and we just have all the processes in place to take care of patients, treatment and post-care. So rehab, we have stroke units, and our nurses have education in stroke, so they know what to do and what to watch for.
Some great advice. You said it's FAST, is right?
FAST, and we actually use the BFAST acronym. So it is FAST. So face, arm, speech, and time, and we've added the B and the E to it for balance and eyes. So if they have any visual problems or balance.
All right, good to know. So keep that in mind. Watch out for your own health and get to the hospital as soon as you can if you notice anything like that. Thanks so much for being with us this morning. We appreciate it. And if you at home would like any additional information on today's topic, head on over to the Hot Links page on WNEM.com.